Today, I will identify 3 exercises, activities, or methods that will help you improve your sexual performance and function. I'm certain you've never heard of the last one. Hello everyone, I'm Laura, and welcome back to the Men's Health Channel. As we know, erection is primarily a vascular phenomenon. Of course, it is also neurological, hormonal, emotional, and psychological. But for a full and satisfactory erection, blood needs to reach the penis with the ideal flow and volume. To achieve this, vascular health must be in good condition. These exercises, associated with improved erection, help enhance irrigation of the pelvic floor musculature and overall vascular health. Blood reaches the penis through oxygen-rich blood vessels, arteries. These arteries are small branches that originate from larger arteries or vessels. Penile blood flow begins in the internal iliac artery, which is actually a branch of the abdominal aorta, the main blood vessel in our body. The internal iliac artery branches into the internal pudendal artery, which is the main arterial branch associated with penile blood flow and erection. This internal pudendal artery gives rise to other smaller branches, such as the cavernous arteries, the penile artery, and the dorsal artery of the penis. These are the vessels that actually irrigate and bring that oxygen-rich blood, which will provide a satisfactory and full erection for the patient. If blood is flowing well, your erection will be good. This is why we prescribe vasodilators, such as tadalafil and sildenafil, for many patients with erectile dysfunction. As they are vasodilators, the arteries become dilated, allowing for better blood flow. Similarly, these pelvic floor exercises and the methods I will mention, all 3, contribute to improving vascular health and enhancing the irrigation of this penile circulation. Number 1. Perineal exercises, also known as Kegel exercises, which stimulate the pelvic floor muscles. The pelvic floor muscles are involved not only in the proper functioning of erection and ejaculation, but also in urinary and fecal continence mechanisms. These exercises of lifting, contracting, and relaxing the pelvic floor can be done at home. Ideally, it's good to consult a specialist, a physical therapist specialized in the pelvic floor. However, a tip to better locate these muscles is as follows. When you are urinating, try briefly stopping the flow of urine. The muscles you use, the muscles activated when you stop, interrupt the urine stream. Those are the muscles you need to stimulate when lifting, contracting, and relaxing the pelvic floor. Another tip is timing. Contract and relax these muscles for 5 seconds. Perform a set of 10 repetitions, 2 to 3 sets per day, for a minimum of 6 weeks. This is one of several protocols that can help you improve your sexual and ejaculatory function. Number 2. Exercises with a penile vacuum pump or vacuum therapy. Vacuum therapy is a modality used in the rehabilitation of erectile dysfunction, for example, in cases after radical prostatectomy. It is also included in protocols to improve erectile function for many patients suffering from this condition. Vacuum therapy involves using a penile pump, which is a cylindrical device attached to the penis to create negative pressure, increasing blood flow and thus facilitating an erection. These penile pumps are easy to find and can be purchased online, either automatic or manual. Automatic ones are generally more recommended for their practicality, but I suggest that before buying any device online, you consider seeing a physical therapist specializing in the pelvic floor so they can recommend the best device for you, preventing you from wasting money. As I mentioned, it's a cylindrical device attached to the penis, creating a seal which will increase blood flow through a negative pressure mechanism. This can be done for 10 to 15 minutes and will provide an erection. Some patients may use a silicone ring at the base of the penis after removing the pump to help maintain the erection. All of this needs to be done with professional guidance, at least for the first time, to avoid causing damage to your genital organ, such as ischemia, pain, and local necrosis. Which are the main complications associated with improper use of the penile pump and constriction ring? This vacuum therapy modality can be used 2 to 3 times per week. Some patients even use it daily, but for a maximum time of 15 to 30 minutes to avoid causing damage to local tissues. Some studies associating the use of tadalafil with vacuum therapy show that patients exhibit better rehabilitation and recovery of their sexual function when compared to those using only the vasodilator, just tadalafil or sildenafil, without vacuum therapy. In third place is the use of the penile extender, a device that is not widely discussed or known, but is frequently used by physical therapists in sexual function rehabilitation protocols and also in some penile lengthening protocols. Have you ever heard of it? Let me know in the comments about your experience, if you've heard of it before or if this is new to you. Although this device can be easily found online, it should be custom fitted, and even the traction should be regulated according to a specific study protocol. These observations are important to ensure the expected performance is achieved. Some studies have already shown that using a penile extender for 1 to 2 hours per day for a period of at least 3 to 6 months can contribute to improved sexual function, erection, penile vascularization, and also leads to penile lengthening in a good number of cases. But as I said, it's important for the patient to be diligent about its use. Use a device appropriate for their size and penile length, gradually increase the usage period, and persist with the treatment. So that's it. Practice these 3 exercises consistently, and you will notice a significant improvement in your sexual function, your erection, and your confidence as a man. And if you want to go a step further, there is a 100% natural, scientifically proven solution that has helped thousands of men regain powerful and long-lasting erections in just 7 seconds a day. Simply point your phone's camera at the QR code on the screen, or click the link I've pinned in the comments to watch a short video that shows exactly how this method works. It's totally safe, easy to apply, and can be done today from the comfort of your home. Now then, continue with the exercises, and if you want even faster and more complete results, this might be the best possible complement.